The 5 types of insulin are: rapid-acting insulin, short-acting insulin, intermediate-acting insulin, mixed insulin, long-acting insulin. Insulin helps you manage your blood sugar levels and helps prevent short-term or long-term serious health problems known as diabetes complications. Insulin helps blood sugar enter the body cells so it can be used for energy. Insulin also signals the liver to store blood sugar for later use. Blood sugar enters cells, and levels in the bloodstream decrease, signaling insulin to decrease too. Timing. Insulin shots are most effective when you take them so that insulin goes to work when glucose from your food starts to enter your blood. For example, regular insulin works best if you take it 30 minutes before you eat. Type 1 is managed by taking insulin to control your blood sugar. You can manage type 2 diabetes in more ways than type 1. These include through medication, exercise and diet. People with type 2 can also be prescribed insulin. Type 2 diabetes? People with type 2 diabetes are occasionally treated with intensive insulin regimens. Intensive insulin treatment requires multiple injections of insulin per day or the use of an insulin pump. How many units of insulin is normal? How much insulin to take per carb? The average person will take about 1 unit of insulin for every 12 to 15 grams of carbohydrates consumed. There is some variation to this, depending on how sensitive you are to insulin. Human insulin may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away: redness, swelling, and itching at the injection site. Changes in the feel of your skin, skin thickening, fat buildup, or a little depression in the skin, fat breakdown. Human insulin is used to control blood sugar in people who have type 1 diabetes, condition in which the body does not make insulin and therefore cannot control the amount of sugar in the blood, or in people who have type 2 diabetes, condition in which the blood sugar is too high because the body does not produce or use. What blood sugar level requires insulin? Insulin is usually recommended as the initial therapy for diabetes if a person's HbA1c level at diagnosis is greater than 10% or if someone's fasting blood glucose level is consistently above 250 mg/dl. Research shows that the best time to take mealtime insulin is 15 to 20 minutes before you eat a meal. Taking mealtime insulin after your meals may put you at a greater risk of low blood glucose, or hypoglycemia. 4 major sites for insulin injection? There are several areas of the body where insulin may be injected. The belly, at least 2 inches, 5.1 centimeters, from the belly button. The belly is the best place to inject insulin. The front of the thighs. Insulin usually is absorbed more slowly from this site. The back of the upper arms. The upper buttocks. Human insulin is used to control blood sugar in people who have type 1 diabetes, condition in which the body does not make insulin and therefore cannot control the amount of sugar in the blood, or in people who have type 2 diabetes, condition in which the blood sugar is too high because the body does not produce or use. What blood sugar